Hi, everybody. It's Sharon coming to you today from KidneyLoveSingles.com. And the reason I'm coming out today with this video is to talk a little bit about hair care and chronic kidney disease and stage renal disease when you're dealing with, you're on dialysis and stuff and you're dealing with that. I want to give a few reasons why you may be experiencing maybe hair breakage, hair loss, or hair thinning while you're on this disease, and some tips on what you can do to kind of help with this problem. I myself am a former dialysis nurse, and I also had two people, or have two people in my family that were on dialysis, and dealt with this disease, you know, for a number of years. So first was my brother, and he was one of the reasons why I became a dialysis nurse. And then it was my stepmom, who I love so much. She's just a wonderful person, and so I wanted to do something when I went into my nursing career that I can, help. My inspiration was from my brother. I wanted to become a nurse that where I can help him through his journey. And through that, it's been one of the best journeys of my life, and I think had I not, I am a woman of a certain age. So had I not gotten to the point where I wanted to get off the floor, I'd still be out there doing it. I just wanted to get off the floor. And excuse my shininess, because I know I'm shiny right now. And excuse my hair, because I purposely left it dry. I left it dry because I'm going to be doing a tutorial on on a hair care product for you guys to just give you a little information about affordable and cost-effective hair care products that can help you in your journey, your hair journey. Okay, so now what I want to talk to you about today is first I'd like to tell you a little bit about what happens to your hair when having this disease. Then I'll give you some pointers, as I said. Now, a person's skin and hair, usually it can become visibly abnormal. Some experience hair breakage, some experience hair loss, and some experience both. There are a number of reasons why this can happen. Some people, it occurs because before starting dialysis, and some it occurs after starting dialysis. And people with renal disease, such as chronic kidney disease. Now, if you see me looking over to the corner, it's because I, did my research and just through experience as well. I'm reading a little bit because I want to make sure I'm on point to deliver the correct information and, the right, stuff for you guys to be able to, take in and utilize. All right. Now, one of the reasons why, first I want to tell you that not only can you experience hair changes, you can also experience fingernail changes, and your fingernails can become what they call opaque, meaning opaque, they're not see-through. They get this whitish, yellowish color to them, and they can become brittle and, just break really easy, just like your hair becomes brittle and break really easy and stuff like that. One of the reasons why this happens is because it could be the result of the nitrogen waste that builds up in your body. Because, your kidneys are your filter, and when your kidneys are not functioning to their highest capacity, then you're not filtering out all the waste. Thus, you have to receive dialysis at the end. All right. Now, another reason is because you could have a vitamin deficiency. Vitamin deficiency can be caused by, some people can be suffering from malnutrition. And all of this can be caused because, your taste buds change when you're on dialysis, or when you have chronic kidney disease and stage renal disease. Your taste buds tend to change. Some meats and some foods can taste like metal. That's from what I've I've heard from my patients that I've dealt with, and the people I've taken care of, and just some research that I've done through what they've learned. The food, the taste buds just starts to taste nasty, and then being that they don't like the taste, you're less likely to eat, which can lead to malnutrition, which can lead to vitamin deficiency. So, also, another reason you could be experiencing side effects of certain medications. Let's go on to the next one. As we all know, hair and nails are made up of protein, and if we're not eating enough protein, our protein sources can be through meat, they can be through fish, they can be through poultry, they can be through eggs. And a good renal diet will consist of a good source, a good amount of protein in your diet. Now, what you can do in regards to not getting enough protein or your vitamin deficiency or things like that, you can speak to your dietitian. If you don't have a dietitian, through your nephrologist, if you're like not on dialysis and you're just experiencing chronic kidney disease and you start seeing some of these changes, you can see if your nephrologist can, or your primary care physician can recommend you to go to a dietitian, and they can really give you very, very good sources where and other ways that you can incorporate protein into your diet, so you'll be consuming enough to help with the nourishment of your hair, help with the nourishment of your nails, and kind of prevent some of this hair loss, hair thinning, hair breakage. Also, you should be talking to your doctor in regards to, or your dietitian in regards to a renal vitamin. The renal vitamin will consist of vitamins that are pertinent to your hair, like B vitamins, B complex vitamins, and other vitamins that you need to nourish your body that can be lost, especially if you're on dialysis. Can be lost in dialysis. And my recommendation for that one, just informational, just is all informational. Don't take your vitamin before you go to dialysis. As you know, dialysis cleans out the body, and sometimes vitamins can be lost along with all the other waste products that are going out of your body. So, a good renal vitamin, a good diet of protein. If you don't have a dietitian, through your nephrologist, you can ask, or your primary care physician. If you're on dialysis, you have a dietitian. Utilize that resource. They can really help you. I know some very good dietitians that will even go shopping with you to help you with choices, to teach you how to shop, to adhere to your renal diet. Also, if you do have a renal vitamin, take your vitamin as prescribed. The doctor gave it to you for a reason. Take it as prescribed. Now, also, there is another resource that you may have that a lot of people may not even be aware of. That's an excellent, excellent resource, because I used to be one of these too. I was a nurse case manager, and they provide so much education to people, and it's done via the phone at your convenience. Don't think they're pests. They are not pests. They are resources. They care about you. They want to see you be the healthiest that you can be, and a lot of times it's incorporated into your insurance, whether it's through your commercial insurance. I'm not sure if Medicaid has any. They may, but if they don't, you always have the ones that are, through your dialysis center or through your nephrologist. So you may be able to see if your coverage will help you be able to see a nutritionist or a dietitian. It may cover it. So I encourage you to utilize these resources if you have them. First, you want to avoid chemicals in your hair. If you can go natural, go natural. Chemicals such as perms, colorings, anything damaging that's going to disrupt the natural makeup of the hair follicle, change it in any kind of way. Sometimes people go when they have these keratin straightening things done to their hair. That can also, even though you think it's natural keratin, blah, 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 that can also disrupt your hair follicle because it had, your hair shaft and things like that, because you have to break it down in order to be able to accomplish the results that you may be looking for. So that's my number one. Avoid perms, avoid colorings. Natural can be beautiful. It can be really, really beautiful. And there are a lot of products out there these days for natural hair care. And that's with all hair types, from type 1 all the way to type 4. From type 1 to type 4C, I should say. That's in another video. All right. So the second thing I would say, avoid using harsh tools such as tight rubber bands, rough combing or brushing of your hair. When you're going to untangle your hair, you should start at the ends and work yourself to the root if you're going to untangle. A lot of times women untangle in the shower while they're conditioning their hair, because there's a lot of slip in the conditioner and it helps to untangle the hair. You want to really use your fingers to untangle as much as possible because it's less harsh than a brush or a comb. So you want to avoid that. You also want to avoid excessive heat use on your hair, such as blow drying, curling irons, or flat irons. If you can use those as least as possible and maybe put your hair in a protective style, that would really, really help your hair to stay healthy, help it to stay on your head, help it to keep it from breaking. And, anything that you don't have a lot of manipulation of your hair will keep it, keep it healthier. Thirdly, you want to use hair care products that promote thick volume and strong hair, whether it be whatever brand that you like. Make sure that it has something in it that's going to encourage thick and full voluminous hair, especially for thinning hair. Take heed to some of the things that I've talked about. Just think about them. See if you can identify with them. If you can, you can do your own research, go in there and see if what I told you is really falling into the line of what you may be going through. And in my next video, I'm going to talk about products. I'm going to talk about hair types. And I'm going to talk about, I'm just going to talk about hair types. And then in the video after that, I'll talk about products. You're all going to see me with my red shirt on because I'm doing this in one shot. One shot, one kill. And that's that. So I just want to tell you all, for if you want to put your own blogs out there, you want to go to your, I go and talk to people within your own community. You can go onto my website, KennyLoveSingles.com, and your profile, you can download your profile for free. For the first 30 days, you get a gold membership, and you'll be able to access all of the features of the website, and you will see how you like it. You can possibly meet somebody, you never know, meet your soulmate, or just give your information, your tips and your things, and talk about your feelings or whatever you have to talk about. It's there for you. I created it specifically for you. So as I end all of this, all of my videos, you'll see me end this with this. Forgive me, I can't get my words out. But you'll see me end with this because this is something that reminds me of my brother. And this is something that he always told the people around him that he dealt with. He wanted to tell you, to all my brothers in the struggle, strength for the journey. With that, I'm going to say peace out.